Hi, we're going to begin a discussion on infections and immunity. Infections are caused by pathogens, and a pathogen is something that generates an immune response. We're going to go to giantmicrobes.com and look at their pathogens. The top row, we have viral infections, such as the rhinovirus, the common cold, and then what Giant Microbes folks put together in what they call their modern plague pack, which includes Zika virus, the flu virus, Ebola virus, and the coronavirus. The second row are bacterial infections, which include the clap or gonorrhea, salmonella, and the bottom row are pathogens known as parasites, which include giardia, heartworm, diarrhea, and malaria. So these are three different categories of pathogens: viruses, bacteria, and parasitic worms. Ugh. Let's look at what our body does in response to being exposed to these pathogens. What is that immune response that's being generated? An overview of our body's defenses include the first line of defense, which are physical and chemical barriers. Our second line of defense, which is our innate immune response. It's nonspecific. It's what we're born with. It's also temporary. These include specialized white cells, such as phagocytes. Phage means eating. NK cells, which are natural killer cells. Macrophages, macro means large, and there's that PHAGE again, which means eaters, and a lot more. And our third line of defense is our adaptive immune response. This is a specific immune response. It's acquired, meaning it develops after birth, and involves T cells, B cells, and antibodies. We're going to go over these many times. So first we have our physical and chemical barriers. These include our skin. Your skin is your largest organ that protects you against infection. Tears wash away something that might get into your eyes. Cilia are tiny hairs that line your nose and your throat. We have the acid in our stomach, the pH of which is similar to battery acid, so that if you swallow something, hopefully the acid in your stomach will kill it before it has a chance to harm you. Normal bacteria, our body is loaded with healthy bacteria, and we like to use these healthy bacteria to crowd out any pathogenic bacteria that might be trying to breach this first line of defense. After this first line of defense, if those pathogens have breached the barrier of that first line of defense, if it's gotten through those physical and chemical barriers, then we have the innate immune response and the adaptive immune response. The innate or inborn immune response, it's what we're born with, includes what are called pyrogens that generate pyromaniac, heat. These cause fever. Fever is an immune response to a pathogen. We have what are called natural killer cells, macrophages, neutrophils, also known as pus, leukocytes, white blood cells, and dendritic cells. We'll talk about how it's the dendritic cells that have these spiky parts of them that will take a piece of the pathogen and present it to our adaptive immune system, looking for that specific, that's the adaptive immune response. It's very specific. And we have in our adaptive immune response very specific cells for a specific pathogen. And these are lymphocytes that are T cells and B cells. So we have the innate immune response, which is non-specific, and we have the adaptive immune response, which is very specific. Once a pathogen enters the body, once it has breached that first line of defense, one of the first responses is for those macrophages to engulf it. And once that happens, they release cytokines. Cyto means cell, kine means chemicals. These cell chemicals that attract the dendritic cells, that attract neutrophils, and attract more macrophages. Inflammation is also part of your innate immune response. When you step on a thumbtack or you get a splinter, one of your immune responses is inflammation. This is on the outside of the body. When we talk about heart disease, we'll talk about inflammation on the inside of the body. Anyway, this inflammatory response is characterized by redness, swelling, warmth, and pain, which are signals that basically say, get off this foot that has stepped on a thumbtack and get it out of here. So we looked at the physical and chemical barriers at the surface of the body. We've looked at the innate immune response, and we'll go over these again, and please ask questions. And then if the pathogen has not been destroyed by these first two systems, then the adaptive immune response is triggered. And the adaptive immune response has three key features. Specificity, in that the response is very specific for a specific pathogen. Remember, the innate immune response is nonspecific. What happens is that these cells will kill infected as well as healthy cells. That's why you feel so bad. Your fever, your headache, these are all because healthy cells are being killed as well as infected cells. But once the adaptive immune response has been triggered, it is very specific for that specific pathogen. This pathogen whose piece was picked up by a dendritic cell and brought to what are called the lymph glands, where it looked for its specific lymphocyte, its specific white blood cell. So the adaptive immune response is very specific, but I also have here diversity. We have the ability to destroy billions of pathogens. And I'll show you a short video in a second to kind of give you an idea what I mean by specificity. But also what makes the adaptive immune response remarkable is its ability to remember the pathogen that it destroyed, so that the next time you're exposed to that pathogen, you won't get sick. Now let me go back a second and explain to you what diversity means. So our body has the ability to recognize billions of pathogens. So how does it know which one is being presented by the dendritic cell? It's kind of a gamble, but it happens really quickly. Let me show you a gamble. There were, in this particular example, 1,000 possible outcomes. Well, okay, 999. But one of them was the winner. And that's what diversity is. It's like you have a slot machine and it works. It takes a couple days to kick in, but once it starts working and once that specific pathogen has been recognized by what are called the T cells and the B cells, then that specific pathogen and only that pathogen infected cells will be destroyed. So let me talk to you some more about this characteristic of immunologic memory. We have what's called the primary or first response to a pathogen, and then we have the secondary immune response. So the primary immune response is this red line. It happens the first time you're exposed to the pathogen. The body hasn't seen it before. The adaptive immune response takes some time to kick in. So we have on the one axis the antibodies, but we also have T cells. We'll talk about how the adaptive immune response, it involves T cells and B cells. And the B cells release what are called antibodies, specific for that pathogen, also known as an antigen. I know, it's a new language, and that's why you should come back and look at this video. So we're looking at time on the one axis and antibodies on the other axis. So the first time you're exposed to the pathogen, it takes a couple days for the antibodies in the blood to increase and to destroy the pathogen. But the second time you're exposed, if you look at this secondary response, you see that it happens a lot quicker and a lot more efficiently. A lot more T cells and B cells are going to be formed because there are memory cells that remember that specific pathogen, and so they react much more quickly to destroy it. If you've never been exposed to an antigen, no matter how healthy you are, you will only mount a primary response, which is slower and not as strong as the secondary immune response. The delayed start to a primary response is enough for a disease to cause serious damage and maybe even death. No diet, no lifestyle, no supplement can make that delay occur any faster. The only way to get a specific immune response and to mount that secondary immune response is to either having previously been exposed to the antigen and having gotten the disease, or getting exposed to the antigen by being vaccinated against it. And we'll talk more about vaccines. And please ask me about vaccines. So let me just review this. The first exposure provokes a primary immune response. So you have your inactive T cells or B cells dividing into effector cells that are going to have the effect of destroying the pathogen or antigen. And then you have memory cells. Once that primary immune response has destroyed the infection and you've cleared it, then you have, moving around your body, these memory cells. Later, subsequent exposure to the same antigen, and that's important to remember, it has to be the same antigen, will provoke a secondary immune response. And what you're supposed to be able to tell from this picture is that the secondary immune response is greater. We're producing more effector cells and more memory cells, and it's also much quicker.